Welcome back to Breakfast Television. As I said, mental health on many people's minds today. A conversation society is becoming more and more comfortable with. I'm joined by Dr. Zach Levine, a ER physician from the MUHC. Welcome back to the show, Dr. Zach. Great to have you here.
Thank you very much.
And yeah, you mentioned, we're going to concentrate on really anxiety and depression. Is that probably two of the more prevalent
Yes.
mental health issues in Canada specifically?
Absolutely. Absolutely. I think depression and anxiety are the most common, but of course, there's a whole range from eating disorders, from addictions, schizophrenia, and other psychoses. So there's a lot of different mental illnesses. But yes, the most common, certainly that we see, I work at the Montreal General. We have a psychiatry unit in the emergency department, and certainly that's the most common that we see, but there's a whole range. And one of the other things that's important to realize is just because there's certain diagnostic criteria, but everyone suffers from anxiety and some depressive symptoms. Just because you don't have the moniker, oh, you are depressed, doesn't mean you haven't experienced it, and doesn't mean you don't need help at a certain time of your life.
I was looking at some of the statistics, and they're saying, by the age of 40, 50% of the population will have suffered from some kind of mental health issue.
Yeah. Doesn't surprise me at all.
Yeah, and I think and as you said, we're all affected, because I think we all know somebody, whether it's a friend, a family member, or a colleague. But let's talk about the symptoms and signs when it comes to anxiety and depression. Not only, looking at other people, but signs that we can look at for ourselves. Sometimes we don't really realize it's coming on us, right?
Yeah, absolutely. So, and by the way, they're quite related, right? So if you have depression, there's a good chance, or definitely an elevated chance, that you suffer from anxiety as well.
Right.
Specifically, the symptoms, signs of depression are, everyone knows depressed mood, you feel sad most of the time, or there's a big change. Something you can notice in other people is a big change. So something that used to interest you or someone else, you're not doing anymore. You just don't, you don't play hockey anymore every Thursday night. You're not going out with your friends. Something, you're not interested. Other things are changes in appetite. Some people, actually, it can be either way. Some people eat more, some people eat less.
Okay.
Sleep, so some people don't eat anything, and some people eat a lot to try and make themselves feel better. Concentration, so difficulty concentrating, difficulty or decreased energy for sure. And then something we also talked about off camera is suicidality. So some people start to have very dark thoughts, and that's a reason to come to the emergency department or get help right away, because that's obviously, if you make that decision, if that actually happens, that's irrevocable, right?
Exactly.
So if you start to think like that, most people, I think, hopefully, realize when that happens, they go and get help. I think that's a red light in many people's minds. But if you notice changes in someone that you love, that's a time to try and bring them to help.
Well, are the changes different compared to, say, children and adults? Do we see differences as far as depression goes?
Oh, definitely. In different times of life. So in teenagers, they tend to be more moody or sometimes more angry. And yes, definitely they withdraw a lot. In older people, it can actually be something called pseudo-dementia, where people are confused and their memory isn't as good and they're not actually demented, but depression can actually mimic that, because they just don't care enough, and they're not, that's one of the things, they don't care, they're not concentrating, and so people think, oh, their memory's not good, maybe they're becoming demented, but actually, they're actually depressed. So sometimes it's hard to tease that out.
Let's talk about treatments. There are a lot of treatment options out there. Some people prefer to go the natural route or go to see somebody. There's great counseling out there. And some people have to turn to drugs as well, right?
Yeah, absolutely. So, yeah, it's not, it's never first-line medications, but yes, there are very effective medications out there for people who other treatments don't work for. One of the things that we've talked about on other shows is exercise. It's been shown to be very, very effective. So regular cardiovascular exercise is very good for treating mental illness, both depression and anxiety. And then counseling, for sure. That's usually the first line, is just talking to someone. And sometimes you don't even need like cognitive behavioral therapy. Sometimes just letting it out. If you've been holding in these feelings for a long time and you actually sit down with someone who cares about you, whoever it is, whether it's a minister or a teacher or a therapist, that can actually be therapeutic in itself, just talking about it.
Do you think we've made strides talking about mental illness and making people feel more comfortable? Because, people, let's be honest, not comfortable telling, their spouse, their family members, their friends. Many people not even comfortable talking to their doctor about it, right?
Yeah. Oh, absolutely. In fact, probably about half of people who suffer from these things, actually probably more, never get help for it and never talk about it. They use other things, and then sometimes that leads to problems. Sometimes people use, like self-medicate with alcohol, that sort of thing. So I do think we've made strides. I do think even over the past 20 years, there's less of a stigma, but it still exists. And so the more that we can talk about it, the better, and the more that people feel comfortable and realize it's not a weakness. It's like any other illness. It's a chemical issue. Some people are more prone to it than others, and it can be triggered if you have, some people have difficult things in their lives that can make them sad, but if you're not able to bounce back normally, then that's the time you need to get help. And it's perfectly, it's just like any other illness. It's like diabetes. You wouldn't not treat your diabetes. Well, you shouldn't not treat your mental illness.
There's a lot of more information, as usual, that Dr. Zach always sends along to us. So we want to encourage you, go to our website, btmontreal.ca, click on our blog section there. There are literally like 3 or 4 pages of information.
A lot of resources.
That Dr. Zach has sent along, and as he said, a lot of resources available to you out there. Don't go anywhere. We'll be back with more BT coming right here in a second.